Thank you, Mr. Speaker. Good afternoon, everyone. Just before I commence the speech on Nurses and Midwives Bill, I just want to allay the fears of the Attorney General and the last speaker, Dr. Mohammed Madio, that during the elections of 2020, prior to that, the no confidence motion, there were three processes. There was the political situation, there was the electoral process, and there was the political process. And so I sat there as a former Foreign Affairs Minister in 2019, and I thought I just want to set the record straight, to read into the answer. The government of Guyana, since the passage of the no confidence motion in the National Assembly on the 21st of December, we challenged its validity. The legal processes initiated were neither frivolous nor calculated to delay the consequences of the no confidence vote. And so they sought to explain more clearly and to interpret certain provisions of the Constitution. And so the court, as you know, it went to the different tiers of the court. And so the court declared that the provision of the Constitution at Articles 106, 6, and 7 applied to a no confidence motion, and that the government member of parliament who voted to support the opposition motion was ineligible to be elected to the assembly by virtue of its citizenship of another state, but that his vote on the motion of no confidence was valid. And you know that. And so that was a political situation in Guyana. And then we had the electoral processor. The CCJ ruled that the process applied to appoint the chairman of the Elections Commission was flawed, void, and in breach of the Constitution. And the government of the day, in accordance with the court's ruling, accepted the resignation of the chairman. The president embarked on a process to engage the leader of the opposition to select a new, and you know the history. And so the electoral process, you would have known. So there was a political situation, there was electoral process. And so the government of Guyana was keen to have elections in the shortest possible time. It had to be satisfied, however, that the basis for the holding of free, fair, and credible elections existed. And so the government of Guyana continued to uphold the Constitution and comply with the orders of the court. And so that was the electoral process. And then finally, you had the political process. The government of Guyana accepted that it was an interim government, and it continued to provide public service. The show had to continue. And so the Constitution at Article 106.7 states that notwithstanding its defeat in the National Assembly, the government shall remain in office and shall hold an election. The government has made it clear that during the interim period, it will restrain the exercise of its legal authority and prepare for the holding of general and regional elections by the Election Commission, which we did. We had to wait on GCOM to give us the green light. And as soon as we got that green light, immediately we went into motion. And so I just want to conclude this part by saying that the government of Guyana was committed to upholding the Constitution, respecting the institutions of the state, including the National Assembly and the courts, ensuring the rule of law, safeguarding human and civil rights, and preserving our democracy, especially through the conduct of free, fair, and credible local and general and regional elections. The Elections Commission is yet to inform the of dates, which I alluded to earlier, and which we did. And so we abide by the Constitution. So I just want that for the records. Mr. Speaker, I rise to speak on Bill 2022, Bill number 6 of 2022, which was published on April 8, 2022, and is under consideration and is now being read for the second time. This bill indeed is coming 12 days after the International Day of the Midwife and 5 days after the International Nurses Day. And so we salute our nurses. The Nurses and Midwife Bill was brought to this August Assembly on October 23, 2018, Bill number 13 of 2018, and had become an act following the assent to the then bill by the former president of the Cooperative Republic of Guyana, the retired Brigadier David Arthur Granger, on January 23, 2019, when he assented to the bill. But, Mr. Speaker, if there is any veracity in the statement that an act should not be repealed until the current one is passed, then how can this bill be repealed if, according to the members of this People's Progressive Party with a small civic component, it was not duly passed? Mr. Speaker, this bill, which is aimed to reform, to improve and to reform the nursing program in Guyana, and at a time where the world is facing a global shortage of 900,000 midwives, it was rather pathetic that on 2018, that day when we had a debate, of course, the former minister, Honorable Balder Lawrence, led the debate, and I myself supported her as the minister within the Ministry of Public Health at the time. And so it was really pathetic that the members of the opposition were, had been absent. And so it just goes to show how much they care, this compassionate and caring government that they claim to have. And so, Mr. Speaker, we know nurses and midwives play an integral role in the primary healthcare systems, in terms of antenatal care, intrapartum care, postnatal care. And so they play a vital role in the health and well-being of women, children, and adolescents. And according to UNFPA, if governments invest in midwives, 4.3 million lives could be saved every year by 2035, thus reducing maternal mortality, neonatal mortality, and even stillbirths. Mr. Speaker, what I'm saying, I noticed the Minister of Health maybe has recused himself. Mr. Speaker, what I'm saying is that this bill, number 6 of 2022, is the APNU AFC's coalition's bill, and that from our mind maybe would have doctored, or rather I should use words that are parliamentary, like adjusted, and maybe it would have reworked and modified. And so here we have this bill number 6 of 2022, the current bill. Mr. Speaker, we on this side of the House, permit me at the onset to say, quoting after a religious leader, we on this side of the divide believe that the only thing that is constant is change, as it allows us to think and act in new and innovative ways. We firmly believe also that change should not be introduced for the sake of change, but because it ensures a better path to the future of our nurses and midwives. The Midwives Act, established in 1953, had sought to provide a framework for the regulation of nurses and midwives, education, principles, and practice. Of course, we know knowledge is power and knowledge is progressive, and it's evolving. You have new training. And so from that time, 1953 to now, there's been an increase in specialized nurses, in auxiliary nursing personnel. Nurses now have extended roles in mental health, in anesthesia, was alluded to earlier, in pediatrics, in neonatal resuscitation, in chemotherapy, in dialysis, ENT and ophthalmology, and even in non-communicable diseases, of course, which continue to take up approximately 70% of our health budget, and does have a public health significance. So may I inform you, Mr. Speaker, that they are now registered specialist nurses. What the APNU AFC sought to do was to have new and improved governing body to provide oversight to nursing in Guyana in a transparent manner, thus allowing for accountability and proper governance to this profession, as the accounts of their council could be now audited on an annual basis. Such corporate body would be responsible for the enrollment, registration, licensing, and the regulation of nursing personnel in Guyana, and to determine the requirements necessary to be satisfied for training as a nursing personnel. The development of code of ethics, the monitoring of compliance of nursing educational institutions to educational standards set by the council, as well as the exercise of disciplinary control via the imposition of fines to persons who have enrolled as nursing personnel and who would be tasked to govern members of this noble profession. It has been pointed out in this bill, like Bill 13 of 2018, that provision has been made for penalties to be imposed as deemed necessary, as in the case of a professional misconduct, or in the case of registration being procured falsely, or if there would be any fraudulent misrepresentation. In addition, Mr. Speaker, for the effective and efficient execution of duties of the Council, several committees, including education, standards, disciplinary, registration, and finance committees, would be established under the new bill. Mr. Speaker, let me just turn my attention to just a few of the points that raised, because I know my other colleagues would have spoken before and I don't want it to be redundant. But just look at part 2 on the clause 3, page 7, speaking about the establishment of the council. The implications for the function of the council as an autonomous body. But currently, Mr. Speaker, there is no council. The minister said that probably he's waiting the bill before the establishment of a council. So that's the implication for the function of the council. But what's the implication for the profession of nursing? What is the implications for the profession of nursing? The main function of the council is to regulate nursing, education, and practice. This includes tasks such as establishment of standards, which I alluded to earlier, nursing education, including licensing exams for nurses, prospective students, ensure that nursing practice, the established code of ethics, and so forth. So there are implications for the profession of nursing, and there are implications for nurses themselves. Absence of a council means there is no licensing body. Student nurses cannot be indexed. Nurses who are seeking their transcript cannot access this document. Students who wrote in May 2022 earlier, their state finals exam cannot be licensed. And so there are implications for nurses. There are implications for nursing care. Acts that require disciplinary actions of nurses, maybe due to malpractice, as I said before, cannot be meted out since there is no council to address this. And implications for the customer, patients, and relatives. The lives of consumers are at stake without a regulatory body. We're going to make, the recommendation is that install the council with immediate effect. The council was in effect since in the 1950s. The nursing profession needs to be guided by its own body and not necessarily by the Ministry of Health, since this leadership can change. Part 2, nurses looking to continue the function of the council. As I said before, under subclause A and B, speaks about enrolling and the registration and certification and so on, establishing the standards of education and so on. Implications for function of the council as an autonomous body. As I mentioned before, currently the schools have been established. There was no council in place to index, enroll, and register these students, ensuring students have the entry requirements for nursing, nor recommending a waiver of this requirement. And if this was a decision of the Ministry of Health through its health sciences unit, well, and so we see the implications for the profession of nursing. The role of the council, as I reiterate, has been relegated to some other authority now. This is contrary to what the bill is promoting. The question is, who registered these nurses and with what power? Since there was a need to open the school then the installation of a council should have been given priority. Hmm? Should any of these students find themselves in an unfortunate situation while performing tasks, since they were not indexed by a council who will answer for them? Hmm? So we have to be very careful. Um, Functions of the council continue in clause 4. It's not included with the functions of the council. We saw that to conduct examinations for nursing and midwifery registration is not included. In the absence of the functioning council, the ministry has established an examination committee through its health sciences division to administer state licensing examination. We have to realize this is not a fly-by-night thing. This council was there time immemorial. And so according to the National Council of Nurses, which Guyana is a member, the International Council Confederation of Midwives, so you have the ICN, the ICM. Guyana also is a member of the Caribbean Regional Nursing Body, the RNB. It's only a licensing agency. So they're different tiers, and so it's not that you're moving out of council, because they already have assigned themselves to the RNB and also to the ICN and the ICM. And so council must conduct licensing examinations for nurses and midwives. And this prevents other agencies from conducting a licensing examination. The standard is set for the nursing by the International Council of Nurses. So you can't do your own thing. Let me have a few people from the health sciences and just set this exam. It's already established. There's a chain of command, so to speak. Implications. We are sure that all will not be well when the establishment of a state examination body be present to conduct the licensing examination. If it's viewed in the eyes of the international body, since the nursing is regulated as a profession by the International Council of Nurses. And so the International Confederation of Midwives and the Caribbean Regional Nursing Body, from which the Guyana Nursing Council takes a direction. And so this is already established. So the minister and they could be advisory, of course, they can, share their advice, but it's already established and it's working, so why change? Having a non-licensing examination is not good for nurses in Guyana. So you can't have an examination and not coming through the nursing body. The council monitors licensed nurses and midwives according to the Nursing Code of Ethics. And so we recommended that in this to conduct state examinations for nursing midwife, that the council do that, since they are the one to issue a licensing certificate on successful completion of such an examination. Nurses are assured of a licensing examination and a licensing certificate. This bill makes provision for several committees, as I alluded to earlier, including an examination committee that should comprise a senior specialist nursing personnel responsible for the application of examinations. According to ICN, this function cannot be transferred to a non-licensing body. Section Clause 5, page 7, powers of the council. The 2019 bill stated established standards of education, training, conduct, and performance for nursing personnel need to be done to ensure maintenance of these standards. So this follows the argument that a regulated body, according to the International Council of Midwives, that's the agency responsible for stabilizing, or establishing, I should say, standards for the training in nursing and midwifery. And so the recommendation would be this new bill should include under Section 2 powers of the council after item subclause B on the established standards of education and training, conducted and performance for nursing personnel, and to ensure the maintenance of standards. Page 9, clause 9, tenure of council. Like my partner, my colleague, MP Vincent, I think the tenure of the council should be 2 years, and that's the voice of the council. They think that 2 years is sufficient, and it's in keeping with Jamaica rule as well. And so to prevent a repeat of the current situation in Guyana, where there is no functioning nursing council, the act should make allowance for some measure to be in place to ensure continuation of the functions of a council. And so you can do that either by the extension of the service by the previous council members or the election of an interim council. All right? And as I said before, for an act should not be repealed until the current one is passed. We go to the last clause I'm going to deal with, miscellaneous, clause 48, under employment. Uh, the statement should read and include the word nursing. You just said, let me read it exactly, page 48. It's there. All right, but it should include nursing is omitted. We want nursing to be included. And so this helps to safeguard the position of the registrar. Okay? Page 27, in the absence of the government subvention, the council has mainly relied on monies incurred from examination fees to pay its staff and to carry out its regulatory and other functions. So if there is no money, you really, I don't know what's the purpose of the finance committee. So you really want to make it either defunct because they're lacking the capacity to take away the powers from them. So how will they function? Is that deliberate, something deliberate, or you want to include in the multiple of council there's wisdom? And so now with a non-licensing committee administrating the state license exams, students are not required to pay. This grossly impacts negatively on the income of the council. How else will the council get funds to sustain itself? Is this an attempt to stymie the disannul the council? Come on, to be frank. Although this is the previous act to have a subvention for the function of the council, a decision by parliament is needed to enact this aspect of the bill. And finally, on the regulation, under part 6, sub clause C, D, and G, what we're recommending, that under C we delete as a function of the minister. The minister has its place, but as an advisory role. The following tasks conferred on the minister, as already stated on the functions of the council, therefore they should not be given as roles of the Minister of Health. All right, regulating the conditions of practice of nursing in Guyana, well, the minister is going to do that. This is clearly the function of the council and should be deleted. D, subclause D, determining the professional qualification and experience required. All right, that should be deleted. And G, establish and enforce standards of practice. That should be deleted and squarely a function of the council. So we don't really want the minister to be usurping the functions of the council. We don't think it augurs well for the relationship of the two parties. And so the council have been doing a good job all the time, and we will want them to continue that. And so let's have some harmony with the council, with the minister. Mr. Speaker, no longer should nurses be seen as only administering vaccines at maternal and child health clinics and attend to the elderly and persons across life cycles. But this category of health professionals would now be positioned to demonstrate practice-based competencies. So, while the traditional bedside nursing can be worth emulating, as such a role is critical and essential to quality patient care, we do look forward to a paradigm shift with the nursing approach, as nurses are now asked to develop leadership roles and become transitional leaders in research, in education, technology, hospital management, and global health. Mr. Speaker, because of the nurses and midwives being able to have a valid license under the Registration and Licensing Act, there would be opportunities via the Caribbean Single Market and Economy, CSME, for the free movement of our Guyanese personnel desirous of seeking jobs in a CARICOM state. It would be expected that, like a snowball effect, trained nurses would teach patients and develop that nurse-patient relationship, which would inform their families about the natural history of disease and its treatment, and will commit to best practices and public patient safety. The Nurses and Midwives Bill 2022 has provided for continuing nursing education for this category of healthcare workers to understand holistic wellness, to attest to the needs of the healthcare recipients, to promote collaboration among the healthcare team, to manage well the resources of the health facilities and institutions, and to work with stakeholders in the community and society to have healthy people and healthy communities, the public health mantra. The bottom line, Mr. Speaker, is that this bill, number 6 of 2022, would help persons in the nursing professions, namely the nurses and midwives, to save more lives, to enjoy a better quality of nursing, to uphold the standards of professional conduct, and to promote a more effective and efficient management of nursing and the medical profession in a modern and oil-rich Guyana. Today, we want the nurses and midwives to know that the APNU AFC coalition, members of this side of the House, we're very compassionate and we care about you and your well being. And so we would appreciate if the nurses and midwives bill will be sent to a special select committee to fine tune the anomalies created by the current PPPC regime. We, the APNU AFC coalition, would have pioneered this bill. And so we look forward to the PPPC making the necessary adjustments. It's the same, so that the persons considering entering this noble profession would be pleased. I thank you.
Thank you very much, Honorable.